1190 WIXE Talk of the Town segment brought to us by Amco Transmissions. Dr. Felix Muniz joins us this morning with Southeast Pain Care at CMC Union as our guest. How you doing, Doc?
Good, thank you. And yourself?
Very first question I had when I came in, Courtney is here with the doctor, and I was asking about these questions they came up with for the interview, and I said, Courtney, did you help come up with these? And she said, yeah. And I said, well, I can guarantee you that's his writing and not yours. And he said, yeah, how'd you know? I said, they must have to take a college course on how to write like
Absolutely, yeah. Special course we take.
Yeah. So how are things at Southeast Pain Care?
Good, very good, actually. We're real busy. There's a lot of people, unfortunately, out there in pain. So we're here to help them.
What do you folks kind of specialize in, so to speak? Just for, assume somebody's listening has no idea what Southeast Pain Care is.
Well, our specialty, first of all, the majority of a physician in our group are anesthesiologists, and we all have a special subspecialty in pain management. The majority of us are board certified in pain management as well as in anesthesiology. So we specialize in the treatment of chronic pain, and that's pain that could go from head to toes, any type of pain. This morning in particular, we're going to discuss back pain, because it's the most common pain that we see in the clinic.
Yeah, and folks, with back pain, you notice so many times, I don't know how many people I've heard say, well, I'm getting older, I'm supposed to hurt. And it's not necessarily true.
Well, there is a little bit of truth in that, and the reason is that as we age, our spine tends to deteriorate, the discs dehydrate, they lose water contact, they shrink, we start getting arthritis in some of the joints in our spine. And therefore, part of that is true, but not necessarily. The important thing is, like, you should never assume that because you're getting older, it's normal to have back pain. Yeah, it's always important to define the cause and a diagnosis and possible treatment.
I think people sometimes, like Shane said, they take for granted they're getting older, they're going to have certain things. They're not going to be able to do things like they once could, you know, and some of that may be true with just because of the aging process, but not necessarily.
Not necessarily, right.
Chronic pain, you mentioned, is just so debilitating because it takes you just completely out of your game. You can't get excited about anything. You can't, because you're in constant pain. It's hard to have any kind of positive attitude or get a lot of positive work done when you're dealing with chronic pain.
You're absolutely right, and the problem is that sometimes after an acute injury, for example, you heal, and there's nothing out there that you can see that explains why you're still having pain. You go to a surgeon, for example, and they do back surgery. They fix your mechanical problem, but you continue with back pain. So people don't understand that. They say, well, I had my surgery. The surgeon says he did everything he could do. Why am I still in pain? And absolutely, chronic pain takes a toll in your life. You know, it affects your social life, it affects your personal life, your job, your interactions with your family members, with your friends. People, I've had people that after successful treatment, they cry in the office and they hug me and say, you know, this is the first time I've been able to go to Walmart and do my shopping, or go to church.
Simple things.
Simple things that we take for granted every day.
How do folks know? Because one of the questions here, how do folks know whether or not what they have is acute or chronic back pain? You know, some people it's just how long it lasts. Is that how you?
Yes, acute pain normally we define as a pain that lasts from a few weeks and less than 3 months. Now, when pain starts lasting more than 3 months, then we consider this chronic pain. Not only back pain, but any type of pain.
Okay. Well, you mentioned about back pain because that. You know, I have yet to meet, I'm sure they're out there, but I've yet to meet someone that has had back surgery.
Absolutely.
And tells you, I'm completely cured. I've known many people with multiple back surgeries. My brother-in-law's had 2 neck surgeries, and he's contemplating a 3rd. And it's just, you know, it's just changed his whole lifestyle. So when you get someone, let's talk about backs for a minute. You know, you see somebody, let's say they've had surgery and they still have the pain. So what can you do for them at Southeast Pain Care?
Well, first of all, we're going to do a thorough evaluation. We're going to obtain a history, a physical examination, you review the medical records that they may have. Also, if they haven't, then we're going to order some diagnostic studies. And
Okay.
we're going to try to look, the main goal is to look for a diagnosis of cause of their back pain. And therefore, after that, we come up with a plan of treatment.
Okay.
So the goal is to help the pain, to improve the quality of life of these people, and hopefully even send them back to work if they are out of work because of this situation.
And I guess for some people, it may be some lifestyle changes.
Absolutely. Yes.
I know I've got neck issue going on, and part of it is a degenerative disc, but it's also very sloppy posture. You know, sitting at a computer and that kind of thing, and more people are in front of computers all day. So part of it is, you know, when you meet these patients and talk with them, you're getting their history, but you're also, what do you like to do? Maybe you find out that they like to play softball on the weekends, and they're not a spring chicken anymore, or they do sit at a desk for 8 hours a day. You might can tweak some changes there. Maybe their weight has come into it, because, you know, obesity can play into these things, or some of their other lifestyle stuff, stress that they're under,
Yes.
whether they smoke or not.
Yes, there are things posture, like you mentioned, is very important, and
Yeah.
you know, it certainly can cause neck pain, low back pain problems, lifestyles, the way we lift or pick up objects from the floor. You know, instead of just bending your back, you need to bend your knees, keep that object close to your body.
Don't
and
twist.
Don't twist while you're doing this. Obese people tend to have back pain, not only back pain, but also other problems such as joint pain in their knees and their ankles. Smoking, people don't realize. I can't tell you how many people I see in the office that they think the problem of smoking is just cancer. Smoking reduces the blood flow to your spine, and it interferes with the proper delivery of oxygen to the tissues. So that if you compare non-smokers with smokers, the smokers are going to have an advanced risk of deterioration of their disc and their spine, and therefore more issues with their low back and their spine per se.
What about folks? When I'm looking at the list of things here that can all contribute to this, and it's a long list. I mean, it goes from fibromyalgia to kidney disease to, as you said, lifestyle and weight, to cancer, to ulcers, to infection. I mean, it's just, I can see why sometimes it'd be so difficult for somebody to find out what's causing the problem. This is a long list of stuff that can
That's
cause this.
just a few of the things that can cause back pain. And that's why I was mentioning earlier to you that don't assume that because you're older you have back pain, it's normal, because there are a wide variety of possible causes and diseases that could be causing your back pain. Luckily, the majority of them are benign and treatable, but in certain locations, we're talking about malignant tumors, or we're talking about other organs in your body that are causing pain. Let me give you an example. I had a 34 years old patient several years ago when I started in this practice, about 9 years ago, that came to the office with back pain. Young, normal person, you would assume, well, maybe she lifted up something heavy. At the time, she used to work out, so I said, well, maybe she sprained a muscle, right? And very commonly you say, well, she's young, there's really nothing bad with her that would be so bad or wrong. Well, I ordered some diagnostics tests because she had not had any of those, and her pain was actually coming from cancer in one of her kidneys.
Oh, Lord.
Wow.
So
Yeah, but the pain was in her back.
her pain was in her back. She had pain nowhere else.
Wow.
So that just gives you an idea of how important it is to look for the cause and the diagnosis of this problem. The pancreas is another organ that can cause back pain. In a situation with females, sometimes they start having issues with their uterus and can also radiate pain to their back or their ovaries. So,
And when you
very important not to only focus on back pain. Has to come just from the spine or the back, because that's not true.
when folks come in and you see them and it comes time to diagnose them, there are the traditional ways, like, you know, the physical examination, the blood workup, and all the histories and things. But you also have a lot of advanced ways that you help diagnose this stuff too, with X-rays. I don't even know what thermography and electro. I can't even say the word is.
Electrophysiologic studies. That's pretty much EMG or nerve conduction study. That's a test that is going to check the function of certain muscles and the function of certain nerves. The thermography is pretty much a scanning of your body, and then via a graph of different colors can give us an information of the different temperatures in the body. There are some conditions that will affect the condition of your the temperature of your extremities in your body.
Some of your back pain exercises, each depending on the patient, you know what they can do. Low impact aerobic exercises, lumbar extension, strength training, yoga, tai chi, qi kong is in kung fu, Pilates or yoga. I know myself at my age. For me, as you get older, I've seemed to have lost elasticity, you know, in my ligaments and muscles and so forth. And I think that, you know, a lot of people get that way and they feel like, well, you know, that's just age. But it's so important for people when they get older to do stretches. And Tai Chi is in here, yoga's in there, and that's all about, you know, putting your feet behind your head and all that stuff. But I mean, to be stretched out is you know, is just such a huge benefit to people, because, you know, some of this neck stuff I've got going on is due to the posture and so forth, and everything's just tight, and you know, that's what's creating, and I may have a disc problem, but it's exacerbated because, you know, I've got this bad posture and everything's stiff and tight, and that makes me feel that pain even more.
Yes.
And to get more stretched out may not help my disc problem. It'll take some of that pain away.
Yes, you're correct. And let me tell you this, that it's funny that you mentioned that, you know, some of these exercises, putting your legs over your head and things like that. But, and let me tell you this, I'm a weightlifter, and weightlifters normally are not that flexible.
Right, yeah.
And I have neck issues. I have 3 herniated discs in my neck. I have low back pain issues too. And one of the nurses that
Dr.
worked
Bill
with,
myself.
one of the nurses that worked with me kept telling me, Dr. Muniz, you need to try yoga. You need to try yoga. You need to, and I felt like, that's not for me, because
Yeah.
I'm going to feel awkward and ridiculous, and I'm not that flexible.
Right.
Well, I finally gave in to her suggestion, and it's the best thing I've ever done.
Shane's sister teaches yoga.
Yeah, she's
All right.
she went. I laughed because she went straight through and got a doctorate degree. 10 years of school after high school, straight through college, and then as soon as she took a job with her degree, she went to learn how to instruct yoga. It's like all that school, and she. But no, she loves it. She couldn't agree with you more. I mean,
Yes,
she absolutely loves it.
And I have to say that it has helped my pain. Not too long ago, I was miserable with pain in one of my arms because of pinched nerve. And
Yeah.
I tried it, and it helped. I can't kiss my toes yet, but I'm getting there.
Okay, now when you first started, because there are people out there thinking, you know, I'm beyond yoga, I'll never be able to do this. You know, I've seen it, or I've seen somebody do it. No way. When you first started, how long have you been doing it, and how long did it take before?
Well, to be honest
seeing
with
some
you, I've
results?
been doing it on a more regular basis for maybe 4 or 5 months.
Okay.
I tried it last summer a few times, and then I kind of quit, and then I started again when this pain flare-up occurred. And absolutely, I mean, it has helped tremendously. So, and the good thing is that, at least the place that I go to, you know, they don't make you feel like you have to assume these positions until, oh, you're going to be.
And I guess
left
there's
out.
different levels, right? Beginner yoga, and I mean, you move up.
Well, there's normally, as far as I know, it's a group of people, but you can tell that everybody's learning
At
at
their
some
own-
point.
yeah.
Everybody's learning at their own pace. You're not required to do every single posture or position that the instructor is doing, and you just take your time. The goal is to heal, not to hurt yourself.
Yeah.
And I'm looking here too, as far as remedies go. There's some truth to a good old ice bag or a hot water bottle sometimes, isn't there?
Yeah.
Yes, that's
If
correct.
you need it, or bed rest. It's interesting you say with the bed rest it says 1 to 2 days at most. Could it be negative for people to stay too long if they having issues with bed rest?
It could be negative, and the problem is that what they say, if you don't use it, you lose it, is true. If you start not using your muscles and your bones, they're going to start getting weaker, your body start getting deconditioned. So yeah, bed rest is okay for a short period of time, but don't get used to it, because the problem is that because we have pain, we tend to just rest and not do anything.
Yeah.
And it's a vicious cycle, it's a negative cycle that is not going to conduct anything positive in your body.